Hello everyone. Today we'll discuss about heart. Heart is the vital organ of the body. It plays very important role. It is a natural pump which is there in the body, which is made up of special muscles that beats rhythmically in order to maintain a good blood flow or proper blood circulation in the body. Heart beats at 72 beats per minute, and the normal heart rate duration is 0.8 seconds. So the heart pumps about 70 ml or half a cup of blood in into the artery into the artery and total 5 liters of blood is in the circulation. The That is the important role that heart is playing in our body, and that is the organ. It is very important. It's a very vital organ in the body, because right after the childbirth till the last breath the person takes, the heart never stops. That important function of the heart makes it as a vital organ. To understand the basic and little the natural beauty of the functioning and the makeup of the heart, it is made up of four chambers. The functioning of the heart is it the left side, two sides are there, left side and right side. So in left side you have, at the top you have left auricle, and the bottom you have left ventricle, and on the right side you have right auricle and right ventricle. Now the left side of the heart, it carries oxygenated blood, the blood which is rich in oxygen, which is in circulation, which is being given to every organ, tissues and cells of the body. And on the other side, the right side of the part, that is right auricle and the right ventricle, they receive the waste or the impure blood. So the heart is a machine. It's a natural pump which acts not only to replenish the body tissues and cells with oxygenated nutrients and vital essentials for the body, for the organs, for the tissues, but also it acts to collect the waste, carbon dioxide, and other residuals which are being eliminated, which are to be removed from the body. So that's why the heart is playing the role of not only giving the oxygenated blood, but also to collect the waste and the unwanted things from the various parts of the body and cells back to the heart also. So, in order to understand it better, let's understand the heartbeat. As we just discussed, the heartbeat of a normal person is 72 beats per minute. Now, the ideal internationally accepted standard, which is accepted across the world, is the heartbeat for 1 year old child will be about 120 beats per minute. The heartbeat for children up to age of 14 years will be somewhere 80 to 85 beats per minute, and for adults it is 72 beats per minute, 70 to 80 beats per minute, and in old age it will be somewhere around 60 to 70 beats per minute. Now, The heart, the left side of the heart, that is left auricle, it the functioning of the heart is very important in providing, circulating, and replenishing every organ, every tissue, and every cells of the body by oxygenated blood, nutrient rich, and replenishing the other requirement which the body and organ and other tissues cells are looking for or required for their normal functioning. So that is controlled from the left side of the heart, that is left auricle and left ventricle. So we need to understand the oxygenated blood which reaches the various parts of body, tissues and cells, that is being pumped from the left ventricle. And once it reaches the various cells, tissues, it the exchange of oxygenated blood and the removal of deoxygenated blood from the tissues and cells will be taken by the capillaries, and that capillaries that extend into veins, and that will be collected back into the right auricle of the heart, which will be pushed into right ventricle. From there it will be sent to the lungs for purification, wherein the carbon dioxide will be taken away and oxygen will be exchanged back into the blood. That oxygenated blood again it enters the left auricle. Then from the left auricle it goes to the right left ventricle, and from left ventricle through aorta and the arteries it spreads to the various parts of the body and cells and tissues. So this is the circulatory system. This is the role, the major role of the heart, which plays for transporting the oxygenated, nutrient rich, and many life-giving substances and requirements to the various cells and tissues of the body through blood, and at the same time collecting the waste back into the heart is the role and responsibility of the heart. So what are the various diseases that we should be looking at, which is related with the heart? And if the proper functioning of the heart is not there, what are the various diseases the patient can suffer or we can complain? Mainly the broad classification of the disease is, when we talk about the onset, there are few diseases which are acute and chronic disease. Broad classification of the heart disease can be as acute heart disease and chronic heart disease. Acute heart disease can be some inflammatory or some because of some stress, some sudden emotional change, some addiction, some internal health problems, the patient will suffer acute heart problem or heart symptoms. Whereas in chronic heart disease, there will be conditions where the muscle fibers of the heart, it gets weakened. The functioning and the normal rhythmic functioning of the heart and muscles, it gets weakened. It's not working properly, due to which the breathlessness will be there, palpitation will be there on slight exertion, inability to lie down flat or on sides because of the chronic heart disease condition, or there may be pain. There may be pain in chest. So these are various chronic heart disease conditions. Now, when we try to dig deeper, and if we further try to differentiate these various heart diseases, there are coronary heart disease. There are, because of blockage in the coronary arteries, we get coronary heart disease. There are heart arrhythmias, that is rhythm, the beats, when there is deviation or the irregular beating of the heart is there. that leads to heart arrhythmias, heart failure. That is also one disease. Heart does not pump blood properly. Fourth is heart valve disease. There are valves in the heart. If you have disease in the valve, the four valves are there, which if it doesn't open and close properly, that will lead to heart valve disease. Pericardial disease. If there is pericardium inflammation is there, that's a lining which is around the heart. If that lining is having inflammation, that is pericardium inflammation. If that type of problem is there, that is also one condition. Cardiomyopathy, when the heart disease muscles, heart muscles, if they get some problem, inflammation, infection, so that is cardiomyopathy. Congenital heart disease, which are the disease which a child is having when the child is still there in the mother's womb. So these type of diseases are the various conditions of heart diseases. And for all the heart conditions, heart diseases and various type of complications, it is very important that the cause should be diagnosed properly. Merely self-medication and negligence and systematic approach not taken for treatment is very harmful for patients in the long run. It is highly recommended that the patient should take necessary precautions and timely consultation with experienced doctors in order to get the proper symptom-based treatment diagnosed properly. The conditions need to be diagnosed properly, and based on the symptoms and diagnosis, the treatment should be planned. And that type of treatment will be not only beneficial for patient to recover from the disease, but it will be saving the patient from all the harmful or the repercussions a patient can suffer for negligence or improper treatment if he takes for his heart and health condition. So when we talk about the methods, what are the methods that we can follow in order to get a healthy heart? As a routine practice, if you follow these type of things, that will be congenial for patient to maintain good heart health. Number one is healthy diet. Patient, individual, he should practice a habit of taking healthy, balanced diet. Number two, avoid saturated fats. Instead of that, prefer plant-based oils that are beneficial for health. Systematic massage therapy, cardiac massage therapy is very effective. Magnet therapy is effective for maintaining healthy heart. Regular physical and yoga breathing exercises are good for healthy heart. So these type of care and precautionary measures, if we maintain, that will be very helpful for patient to maintain healthy heart and to keep disease away. And if they have any type of heart related problems, they should not take it lightly. They should not neglect it. They should not postpone it. Self-medication should be avoided. So they should take utmost care for all the health problems. So for that, if any type of heart related problem, if you want to discuss, you want to consult with me, you are free to connect with me on my social media handles, and you can connect on my number as well. So looking forward to have a healthy, safe, and long life for you and for your loved ones. Thank you. Take care.